We're talking about the importance of good oral health, especially this time of the year when we tend to let the candies and the sweets catch up with us. Dr. Preety Desai is joining us, laser implant periodontal specialist. Great to have you back on the show.
Thank you, Susan.
We are talking a little bit about something that I don't think a lot of people think about, and that is that there's a correlation between stress and your oral health.
Very much so. In studies, there are two kinds of stress for humans that we face. Some is the acute stress where we, get a trauma to our leg or an infection in our finger, and that's acute, where the body fights infection as it's supposed to. The bad kind of stress is the chronic stress. Say you have a boss that is not so nice, and for 5 years you have a very negative, environment to live in. That kind of stress plays on your body in heart disease, cancer, and also gum disease. This is the time of year I see one of the most amounts of emergencies in my office because of stress.
Really?
Mm-hmm.
And how does that stress show itself in your gums? How does this happen? How does that happen?
Great question. What happens is that the stress on a day-to-day basis changes actually the DNA of some of our white blood cells and our immune cells. And so they can't fight infection quite as well. It changes your physiology on a day-to-day basis. This is what results.
So your body slowly breaks down, and this is the toll it takes.
Exactly.
We have some pictures that you actually sent along, and perhaps you can show them, we'll show them rather, and you can tell us a little bit more about them. Here we go, here's the first one. This is
the first same patient where the mouth in the first slide shows a week of inflammation and infection. And when treatment resulted in resolution of symptoms, it's because the stress of exams was reduced for this one particular person, and antibiotics was used as well. So this is a week later, the difference.
What a huge difference in a week.
Yeah.
Second picture shows us, well, there's this one, and then there's a second one,
So this is a nice, healthy mouth, and 3 days later, after a very stressful personal experience, this is what happened. All of a sudden, it's bang. You can see the red changes, the brown changes, and acute pain.
Is this a patient of yours?
This is a patient of mine, yeah.
How does that happen so fast? I don't understand.
What happens is that over time, the plaque builds up. In a day, the body can't cope quite as much as on a regular, healthy, non-stressful episode. In Christmas time, we see it a lot, where all of a sudden, bang, you have to do so many things in one day, I can't cope, and you don't take care of yourself, your nutrition plummets, and all of a sudden your mouth is your lightning rod.
Let's talk also about the clenching of teeth and teeth grinding. That's stress related, and that can have an effect on your teeth. People should wear mouth guards if they're grinders, I know.
It definitely plays a role. It's not the main cause of inflammation, but it can definitely make things much worse than they have to be. So mouth guards are definitely a thing that you can discuss with your dentist, whether it's a nighttime guard, which is what most people have, or some people even have a daytime guard.
So your advice would be to people, try not to let stress get the best of you, because the long-term effects can be quite showing.
And so simply said, absolutely, right? But at this time of year, we just see it more. And so rather than putting extra stress on us, at the end of the day when you're like, oh, I don't have time to brush my teeth or take care of myself, just got to get to bed or got to get the kids' lunches made or whatever, throws you off, just take 30 seconds, calm down, go to the bathroom, maybe brush and floss your teeth. Maybe that's your meditative state. And just take care of yourself. It's the best gift you can give to yourself and others.
Absolutely. Great advice, Dr. Desai. Thank you for being here today.
Thank you so much, Susan.
You're very welcome. If you have questions or any of this has resonated with you and you're thinking, maybe I should check in, the number's on the screen as well as the website. We're back in 90 seconds. Stay with us.
So show me family, all the blood